We use a watermelon model for learning and teaching percutaneous renal surgery tract dilation and the creation of the percutaneous tract. It had been used during several workshops and courses in percutaneous renal surgery. It allows to train on all the maneuvers for creating the percutaneous tract. Implementation of a security guide. Dilation with sequential or one-shot amplets dilator, balloon dilation, Alkin telescopic metal dilators. If watermelon is not available or it is not watermelon season. Alternatively, for this model, fruit or vegetables, which have a hard and thick rind, similar to watermelon, can be used. For example, pumpkin, gourd, winter squash, especially yellow melon, butternut squash. We present a percutaneous dilation model based on a winter squash wedge, which is placed on a mason glass jar. Puncture with 18-gauge needle. A hydrophilic guide is inserted. Then it is coiled into the glass jar. This allows visual control of the progression of the guide and dilation. A 10 Frenches dilator is advanced over the guide wire and the tract is dilated. We did not make an incision in the watermelon rind around the guide to maintain the hardness and difficulty of the dilator progression, which brings a close sensation to the real percutaneous dilation or even more difficult. The amplet's central catheter, 8 Frenches, is inserted. Then, we go directly to the amplet's dilator 24 Frenches, performing a one-shot dilation or a single step, which is the standard tract dilation routinely carried out at our department since 2004. After pre-dilatation to 10 or 12 Frenches, we dilate directly with a 24 Frenches amplet's dilator for standard PCNL, 16 or 18 Frenches for the mini PCNL. The subcutaneous and musculo-aponeurotic passage is the hardest moment of all the tract, which requires applying a force on the dilator. The hard rind and thick wall of the squash or watermelon reproduce this consistency and hardness of this passage. Then insertion of the 24 Frenches amplet's sheath. The sensation of the resistance of the rind and the thickness of the squash wall, and the progression of the dilator is similar to the feeling of the real dilation. Several types of squash can be used. The nephroscope can be used for endoscopic exploration, and possibly, the extraction of pumpkin seeds. A model based on a vegetable with soft skin, such as in a grapefruit or eggplant, allows the different stages of dilation to be carried out. But it does not give the sensation of hardness and difficulty of tract dilation, compared to a watermelon or pumpkin. We had made many workshops of percutaneous tract dilation using different vegetables.